Grief can make you feel like you are losing your mind, but is it really true that your mental health is taking a nosedive, or is it just normal grief? So grief and mental health get really confused all the time because we think that good mental health means that you are happy, you're resilient. If there are things going wrong, you're not actually that bothered by them. When you don't match that description of good mental health, it's really easy to think that you have a mental illness or that you have a disorder. And certainly our clinical and medical therapy terms don't help that. We do this thing as humans where we self-diagnose ourselves all the time. Like, I'm depressed, or I'm anxious, or I have this disorder, or I have OCD or ADD. Like, we have all of this barrage of initials that we give ourselves all the time. It's sort of this constantly under the microscope of mental health. Grief is no different. Because we don't talk about the reality of grief very much, people think that their normal, healthy, very expected grief is actually a mental disorder or it's a mental illness. You might have questioned your sanity for yourself, or probably you've had well-meaning friends and family or even medical providers suggest that there is something wrong with your mental health or that you might have a diagnosable mental condition, when the reality is you're just grieving. So let's talk for a minute about what grief actually is. We think that grief is one thing. It's one emotion. It's one emotional state. But that is really a bucket term for pretty much the totality of being human. So grief can be sadness, it can be anger, it can be lethargy. Grief shows up in the body in a million different ways, which we will talk about in another video. Grief shows up in your interpersonal relationships. It shows up in your guts. It shows up in your mood and your anxiety levels. Grief is really shorthand for a whole bunch of different experiences. This is one of the reasons why there's no one formula for grief, and everybody grieves in different ways. But let's talk about that connection between grief and mental health, because we do think that being sad or feeling down or not being that psyched about whatever's to come in the future, we think that that means that there's something wonky in your brain. That's not necessarily true. A lot of people ask, what's the difference between grief and depression? Is this grief or am I really depressed? But what about the anxiety that I feel? There are so many different ways to be affected by loss, and none of them are necessarily a mental health condition. Part of this is that we have this idea that good mental health means you're happy or you're happy all the time. That's just not human. We're all a mix of different emotions. Like, if you were happy all the time, no matter what's going on, that would be a concern to me. That would be a marker that maybe we need to actually look at what's going on under the hood of your brain. People shift and change, and it doesn't mean there's anything wrong with them. Now, I do want to say that there are diagnosable mental health conditions that cause a lot of pain and a lot of suffering for people. So when I'm saying that grief isn't a sign that you're losing your mind or that your sanity is in question, I'm not saying that it feels good, right? So let's not conflate those two. You can be suffering, you can be in a lot of pain and still be healthy and still be dealing with your mental health in a way that makes sense and is rooted and grounded and good. It just feels like crap. We have this conflation of feeling bad is bad and feeling good is good, and that doesn't do us any favors. Feeling sad is not a mental disorder. Feeling overwhelmed, whether with your own personal life or the state of the world, not a mental disorder. The way that we come to the things that happen to us in our lives, the way that we interact with the world, the way that we are affected by our relationships and the world around us and whatever events erupt in our lives, like, being affected by that does not mean that your sanity is in question or you're losing your mind. If it feels bad, it doesn't mean it is bad. Okay, so having said that you are not losing your mind, even if it feels like crap, let's talk about some of the things that actually do come up inside a normal grieving process. Quick definition of normal. In the medical world, we use the word normal to describe expected. Normal in a medical or clinical context means this is expected, not it's right, it's wrong, any of that stuff. It just means, yeah, this happens a lot. So in normal grief, there can be anxiety, there can be despair, there can be anger, There can be numbness, where you're not really sure if you're in there. There can be a whole lot of things that feel uncomfortable, but again, it doesn't mean that you have a disorder. One of the things that really irritates me about the ways that we talk about grief and mental health in this culture is that if you're distressed, you're doing it wrong, and if you're doing it wrong, then you clearly have a disorder. We talk about mental health as a pass-fail sort of situation for the human heart. You do things correctly and all is well and your mental health is stable and you don't need a diagnosis and you don't need support because you got this, or you're a hot train wreck and everything is falling apart. You have a diagnosis or a disorder and you need help. Remember that there is a big middle ground of human experience in there. We can't talk about grief and mental health and getting therapy or getting support for whatever's happening in your life without talking about prolonged grief disorder. Prolonged grief disorder had a moment in the spotlight where all of these newspapers and news outlets were talking about it. Prolonged grief disorder is a made-up illness. It is a made-up condition that helps insurance companies decide whether or not they're going to pay for your therapy or pay for your treatment. I am massively oversimplifying why we have diagnoses and disorders and diagnostic codes, but shorthand will work here for now. The whole reason that we have prolonged grief disorder as a condition with which you can be diagnosed is that it lets the insurance companies know this person has a condition and they have to have support, therefore we consent to pay for it for like 6 sessions. So here is a quick rundown of how insurance works when you are in a culture that has managed care. Super simplifying this. But prolonged grief disorder, like all mental health disorders, is a code that your therapist will use. They'll look at what's happening for you, they'll listen to it, they match that up with a set of criteria. They say, oh look, you have this, this, and this matches this condition. And then they send that code out to your insurance company where somebody in a cubicle somewhere gets to look at those numbers and say, yeah, okay, they deserve some help. We're going to approve 6 sessions because you gave them this diagnosis code, right? So very shorthand, super oversimplified. Things like prolonged grief disorder or anxiety disorder or major depressive disorder, they are all shorthand that helps the insurance company make a decision as to whether or not they're going to pay for your care. So prolonged grief disorder is a relatively new diagnosis. It got a lot of press time a couple of years ago. It still shows up in big exposure articles when we're talking about grief and mental health. Prolonged grief disorder is sort of in the ancestral line of the 5 stages of grief. It is a simplified way of looking at a human condition. It looks at what happens for normal human beings going through a hard time and says, here's the way to do it correctly, and here's the way you're screwing it up. It is a way of assessing how uncomfortable do we feel around this person's pain? How big are their symptoms? How messy is this? How much is it disrupting their ability to go to work or keep the house clean or keep up with any of those external expectations that we have of ourselves and of others when something goes horribly wrong in our lives. So prolonged grief disorder is just another way of judging, honestly, the human condition. Are you doing it right? Are you doing it wrong? So grief and mental health obviously have a connection. Going through something really difficult does impact your mental health. Just because we're not going to call it a disorder or a mental illness doesn't mean it doesn't suck. It doesn't mean you don't deserve support. Sometimes I think we tell ourselves, like, so many other people have gone through this, I don't really need any help, because we have sort of this internalized idea of how to do it correctly. Even if we mentally say, I know whatever I'm going through is normal and expected, we've all absorbed that structure that says right way, wrong way, mentally well, mentally ill, all of that stuff. So even if you know that it makes sense that you're feeling how you feel, you probably have that lens that you turn on yourself sometimes that I shouldn't be taking it this hard, or honestly, this just sucks. I'm anxious all the time. I'm expecting more terrible things to happen. I don't feel like getting out of bed most of the time, even though I have responsibilities. So grief absolutely does impact your mental state. And just because we understand that it is not an illness or a disorder doesn't mean that you don't deserve support. It doesn't mean that there aren't tools that are available to you to help take care of your mental health when you're going through really hard times. It just means that we remove that lens of judgment and we surround this normal, healthy, crappy experience with tools and skills and support that help you survive what you have to survive, not erase what you have to survive.